Hi, let's go over the quick facts about the medical or doctor internship in Australia, starting right now. What is the purpose of the medical internship? Well, the purpose of the medical internship is generally seen to be an opportunity to consolidate after medical school and be assessed as a safe practitioner prior to general registration. Putting it simply, the medical internship forms a provisional or pre-registration year between medical school and working as a clinical doctor. It can be considered as a bit of a final test or observation of a trainee doctor's capabilities prior to being able to work independently. Historically, the internship formed the final barrier to general registration, after which doctors could work independently in a number of roles, including in general practice. At one point in history, medical schools were in fact more clearly focused on preparing their graduates for entering into general practice. However, the amount of medical knowledge and the nature of general practice in particular has expanded exponentially, so significantly so that sending doctors out into the community to work independently after only an internship is no longer considered to be safe. And the option to work as what is termed a non-vocationally registered doctor in general practice was removed in 1996. So whilst officially the successful completion of the internship is seen as the last step in obtaining general registration, the reality for trainee doctors now in Australia is that they continue to work in supervised roles for a number of years after completing internship. In fact, the nature and purpose of the internship in Australia has recently come into question with a national report recommending significant changes. You can read about that here, and I'll put a link in the description below. So who is eligible for a medical internship? Medical internships are intended to provide graduates from Australian medical schools a provisional year of experience and are not intended for other doctors such as international medical graduates. As I've highlighted in other videos, medical intern positions are reserved for students graduating from Australian medical schools. This includes both Australian citizens and permanent residents who are enrolled in these schools, as well as international students who are coming from overseas to study in Australia to study medicine. It also includes graduates of the two New Zealand medical schools who are also able to apply for internship in Australia, although generally very few do. A common misconception is that IMGs are eligible to apply for internship. Whilst technically they can apply in limited circumstances, the reality is that most do not even require an internship, and the chances of obtaining one for those who might are extremely limited. There are simply not enough intern positions available each year to permit the many hundreds of IMGs in Australia to also undertake a provisional year of experience. And so these particular doctors do need to look for alternative posts, usually resident medical officer positions, and I'll put a link to a video about that in the description below. In 2020, at the current count, there are approximately 3,615 medical intern positions in Australia. The smallest number are in the Northern Territory and the largest in New South Wales. The number of intern positions goes upwards at a small but steady pace in Australia every year. The number is fluid, as there is often a handful of increases after each state and territory publishes its official numbers. Also, there are sometimes a few late withdrawals, which brings down the total number of positions occupied. The major driver of increases in intern numbers is generally the number of medical students graduating from the Australian medical schools. See, failure to provide provisional registration opportunities to these graduates has downstream effects on the other parts of the medical training pipeline. So a fair deal of work goes into working out how many medical students Australia needs, based on how many doctors we need at the end of the day. But as medicine is complex and a long training pipeline, getting this medical workforce planning correct is a difficult task. It is also safe to say that a fair bit of politics comes to play in the internship debate. Announcing new medical schools, particularly in rural or regional areas, is a favourite thing to do for political parties, and obviously these new schools need internships for their graduates as well. In a nutshell, you fill in a form, usually online, for each state and territory that you want to apply to for an internship. You will need to submit a number of details, and it's definitely worth checking ahead of time what these are, because you may be asked to do things like certify your English language proficiency, your change of name, or your citizenship or visa status. You'll also need your intern placement number. This is a number that is generated by the Australian Health Practitioners Regulation Agency and is provided to all medical schools to issue to their graduating students. The IPN helps to track candidates through the process and the system. In most cases, you'll be asked to submit some form of CV or resume as well as some referees. This is not the case for New South Wales other than its rural pathway. Some of the application processes are just a plain matching system, but others also require you to participate in a formal selection interview process. Most of the jurisdictions use some form of software program or database to fairly allocate graduates to placements. Within these systems, there are usually options for you to apply for things like rural placement, and if you do so, you will generally be allocated first. New South Wales also offers a preferential option for Aboriginal doctors to be placed, and other states and territories really should be doing the same. There are also usually processes for applying for special consideration, for example requesting certain locations based on carer responsibility or health needs, and some jurisdictions will allow you to even ask to be allocated with your partner if you're happy to be graduating with someone else at the same time. Victoria even allows you to defer your placement for a year. For medical students who are classed as international students, the Junior Doctor Training Program Private Hospital Stream, that's a bit of a mouthful, provides an opportunity to gain an internship outside of the normal jurisdictional process. How and when you're allocated depends on a few key factors. The main things that will affect how and when you're allocated are if you are an Australian citizen or permanent resident, and if you are graduating from medical school in a particular state or territory. If the answer to both of these questions is yes, you'll normally be given the highest priority for that particular allocation process in that state or territory. The rankings then vary for each state and territory, but in general, medical graduates with citizenship or permanent residency get higher preference over those students on visas. Each state and territory is slightly different, but in general, most of the dates are actually aligned. Allocations are normally open for around a month in May of each year. The first round of allocations normally occur in July and continue till around November. Offer timings are coordinated across all the jurisdictions. After this, there is what's called a late vacancy management process where each state and territory is free to make offers as they need to. In some cases, they are making offers up until the intern orientation week and sometimes even into the first term of the next year's internship. The Junior Doctor Training Program Private Hospital Stream process is advertised as an expression of interest process later in the year, and its allocations are done separately and normally after most of the jurisdiction places have been allocated already for obvious reasons. Going back to 2012, there has been concern that certain groups of students, the international students, might be at risk of missing out on an internship position. The fact of the matter is that there's no actual evidence that anyone misses out on gaining an internship. It's a little bit more complicated than that, in that some of the international graduates are probably choosing to go back to their own country to complete their internship. But with the Commonwealth Government stepping in and providing some additional places, it usually ends up that all the states and territories exhaust their internship positions, in fact might have one or two vacancies at the end. So during internship, you're at the start given about 2 weeks to gain an orientation to your hospital or network, which normally includes a period of overlap with a current intern to buddy with them. After this, most interns tend to work in rotations of either 4 blocks or 5 blocks. And these will last either 12 weeks for the 4 blocks or about 10 or 11 weeks for the 5 blocks. By the medical board requirement, these blocks have to include a medical rotation, a surgery rotation, and an emergency medicine rotation. Most interns also have to work in a relief term where they cover other interns on leave and often take their own leave. So this usually doesn't leave much time or many spare rotations for any choices in terms during this internship year. Mostly for any optional terms, you'll be offered either the choice of an additional rotation in medicine, maybe surgery, or something else like psychiatry. It's been quite some time, in fact many decades since I've been an intern, so I have to rely on what the interns that I work with tell me about what it's like to be an intern and what I observe from them. The positive aspects of the job are often reported to be the amount of support and supervision that you get, not just from senior medical colleagues, but pretty much everyone else in the hospital. You see, everyone tends to recognise that you're new and are keen to help where possible. Added to this is the collegiality, camaraderie and help that you can expect from your other colleagues. Plus, you're now getting paid, which is a bit of a bonus. Key downsides seem to be the feeling that you're often being employed as a glorified administrative assistant. You see, interns tend to be confronted with and deal with the brunt of the paperwork, really computer work, in the hospital. And some days can seem like an endless parade of updating the notes, completing discharge summaries, following up consults and checking on results. Many interns that I speak to tell me that the best learning experiences often come after hours, when you're doing things like evening and overnight cover. These are the times when you can feel like you are truly using your medical knowledge to address things like urgent patient reviews, and the paperwork seems to take a back foot in those situations. You can also expect to get some regular formal teaching, about half a day a week or maybe half a day a fortnight, but most of your learning and teaching will occur opportunistically on board rounds and in other clinical settings. Being proactive and asking for feedback and opportunities from seniors is a vital key to getting most out of the experience. Now, the amount that an intern gets paid actually varies around the country. The lowest annual wage currently is in the ACT at a little over $68,000 per annum, and the highest is in Western Australia where it's a bit over $78,000 per annum. Depending on where you're working, you should also factor in about 25 to 50% extra for doing some overtime or working weekends and evenings and accumulating penalty rates. There are formal outcome statements for internship written by the Medical Board of Australia. And funnily enough, these align with the medical graduate outcome statements and indeed the most common medical competency framework, the CAMEDS framework. Whether you achieve all of these outcomes or not is a bit of a moot point, as the individual sign-off is more dependent on supervisor reports than a focus particularly on the curriculum. On a practical level, you can expect to consolidate the medical knowledge you gained in medical school and develop or improve a whole range of new skills, particularly tactical skills like personal and team time management, collaboration, and of course verbal and written communication skills. Currently, you complete internship by successfully completing at least 47 weeks of full-time work comprising some specific term requirements of 8 weeks of emergency medicine and 10 weeks of medicine and 10 weeks of a surgical rotation. Your terms and rotations are assessed by completing a mid and end of term supervisor report. Your supervisor is generally a consultant, and they're meant to sit down with you and go through a series of questions and ratings that assess things like your knowledge, prescribing, procedures, communication, teamwork and professionalism. Hospitals and networks have committees to collect these forms and review the progress of all interns, including flagging those that they might have a bit of a concern about, or ones that they might feel need some additional support. These committees may have some additional requirements for your progression, such as minimum attendance at teaching sessions, but largely they rely on the supervisor reports to assess your progress. If your supervisor reports are satisfactory, you will probably be signed off at the end of the year. If not, you may need a little bit more time to complete the requirements. This might be due to a performance issue, or perhaps maybe because you had to have some time off for another reason. This is generally not a problem. In some cases, the jurisdictions give you a 2-year contract to cover some of these circumstances. In others, they can usually extend it for a little bit to give you a bit more time. So once the hospital is satisfied with your completion of internship, you will be recommended to the medical board for general registration. Yippee! For most doctors, not much else different happens, as they elect to stay in the hospital system for at least another year as a resident medical officer. You'll be able to call yourself something other than an intern, and you'll get a slight bump in your pay, but that's about it. In some cases, you can apply to enter into specialty training. For example, general practice is one of the big ones where you can apply as a postgraduate year 2. But most choose to wait another year before trying. Hey there, I'm Dr. Anthony Llewellyn. I'm the Career Doctor on YouTube. I'm here to help you manage your medical career. If you've been liking these videos, please leave me a like down below. If you've got a question or comment, particularly about the intern or training process in Australia, leave one below. And if you're finding these videos helpful, please subscribe and turn on notifications, and I will see you in the next video.